Hey there, I'm Dayna Johnson, dental practice management expert, certified Dentrix trainer, and founder of Navoni, revolutionizing the dental industry through innovation and strategic leadership. It wasn't long ago that I lived in your shoes, navigating the daily challenges of managing a dental practice with the hopes and dreams of having a productive schedule, money in the bank, and getting home on time to my sweet daughter. After 25 years working in the dental practice and 17 years as a certified Dentrix trainer, I found my life's work, helping dental teams one-on-one, optimizing their systems and software. If you are looking to create the thriving dental practice you have always dreamed of and empower your high-performing dental team, you are in the right place. Let's get started.
Hey, welcome back. Okay, we are going to continue our conversation on the 8 oral health indicators that are part of the FDI and Henry Schein Integrated Health Records Project. Okay, that's a lot. That was a mouthful, but I have to make sure that I am talking about the right thing and that you understand what I'm talking about. So, couple of weeks ago, well, by now, it's probably a couple months ago, of course, you heard that I did an interview with Dr. Ryan Hungate, who is the clinical director for Henry Schein 1 and has been heading up this project with Henry Schein and the FDI on the Integrated Health Records Project. Okay, so a couple weeks ago, I outlined the 8 core oral health indicators that are in the project. And I started with number 1, periodontal charting. Periodontal charting is a non-negotiable. So if you want to re-listen to that podcast, it was a couple weeks ago. Today, I'm going to go into number 2. So number 2 on the 8 core oral health indicators for integration, the number 2 is caries and endodontic health. So we are going to dive into what does that look like inside of your Dentrix software? Now, of course, this project, even though this project has been in collaboration for about 5 years, the actual implementation of it is just now beginning. Okay, they just actually launched it to the public in March during the IDS conference in Cologne, Germany. So it's very new to the public. I am here to help you get started with the software pieces. And of course, as I hear more information, I will be releasing it to you. But I want you to start now. And I'm going to talk about 3 things that you could start today. I'm going to outline these 3 options for you for charting in your Dentrix chart. And as I get more information, of course, I will be forthcoming with information. But there are 3 ways that we could start documenting caries and endodontic health in our Dentrix software today. And now, as the software starts to evolve, I will be hearing more about which one of these 3 options is going to kind of be the main go-to. But the more you can document now, the better. I mean, the better clinical documentation we have to be able to give to insurance companies for claim payment or provide for our patients for giving to a referral or their physician, maybe they're diabetic or, they're going through some systemic health problems. The more information that we can document and be able to give to our patients, the better, So I'm just going to throw out ideas and then you get to pick which one I think is going to be better for your office. Now, of course, I'm going to give some recommendations. And so let's dive in. Now, if you go to your patient chart, of course, all of this is revolving around treatment planning. Everything I'm going to talk about today revolves around treatment planning because you are documenting oral pathology or you're documenting things in the patient chart that need to be addressed, right? So if you go to let's say you're going to treatment plan a filling, okay? A basic two-surface composite filling, your D2392, I think is what it is. And so when we go to the patient chart and when we're treatment planning a filling, a composite filling, or maybe you're just setting it complete. Maybe you do a lot of same day treatment, but you want to document the caries that is related to needing to have that filling. So there's a couple different things that you can do. And whether it's a crown, whether it's a filling, whether it's a root canal, you're documenting the endodontic health, whatever it might be, we do have to document the diagnosis, the reason why, what's going on with this tooth, why do we have to treat it? So the first option you have in your Dentrix software is you can chart conditions, okay? If you're just fresh out of dental school, I remember when our new doctor, I worked for a dentist for 18 years. He was a very seasoned, experienced, highly, technical dentist. He was amazing. And his son came and took over the practice after he graduated dental school. And so when he graduated dental school, he was taught to always document the conditions first and then treatment plan. And so when he started working in our practice, of course, that is exactly what he did. He kind of turned our processes upside down and he said, well, we have to document conditions first. So we did that. And that is a great way to chart the caries or the oral pathology that's going around with the different teeth in the mouth. So that is one option. You can chart conditions on all of the teeth or the oral cavity, and that's totally fine. Takes a little bit more work for you to chart caries and on all of the teeth that have active caries. There is a condition already built into your Dentrix patient chart. Let me look it up for you. I can go into my Dentrix software right now while I'm talking with all of you. And the conditions, if you're looking on the procedure code list, you'll find the conditions. There's a conditions category. So you can click on your conditions category. And then there is a caries condition code 15105. That is a Dentrix condition code. It doesn't link to the AMA or the ADA or anything like that. It's a Dentrix code that's inside of your conditions tab. So you could go through and chart all of the conditions for your patients using the conditions tab. And that will then put a color on the odontogram, on the tooth chart, for all of the places in the mouth that have caries. Totally fine. Now, when you go in and you treatment plan how you're going to treat the caries. So you might be doing a filling, you might be doing a crown prep, and so you treatment plan the stuff to be completed. It shows up in the treatment plan. And then when you post set complete, what you have to remember to do then in the Dentrix core software is then you will have to go in and inactivate the condition. So if you choose to use conditions as a way of documenting the clinical caries or endodontic health based on or one of the number 2 of the 8 oral health indicators for integration, then you will have to remember to go in and inactivate them. Now, if you're using Dentrix Ascend and you're using the treatment planning feature in Dentrix Ascend, it connects the condition with the treatment plan. So then when you post set completed, it does set complete the condition as well. So it does it all in one process. I'm hoping that Dentrix Core will do that eventually, but for right now, the conditions are separate than the treatment plan, and we do have to remember if we're going to use conditions and then we treat the tooth, we will have to inactivate the condition afterwards. So I just want to let you know that. So that's your first option, is to use conditions. So it will put a different color. Of course, you can know that you can make the colors on the chart, if you go up to setup and you go to clinical or you go to chart display setup, you can set your conditions to be a different color. So you could have all your conditions as black, then all your treatment plan is in red, all your completed work is in blue, and all your existing work is in green. So that's probably a very common color scheme. So that's conditions. And the second option, which is one that I use very frequently, is procedure notes. So I will treatment plan, say I treatment plan a filling or a crown prep or whatever, or a root canal, and then I will use a procedure note for documenting the diagnosis for that procedure code. Now, the reason I like procedure notes is it attaches itself directly to the procedure code. It's easy to find because when you're looking in your progress notes panel, you can see, oh, we have a filling on tooth number 12, or treatment planned. It looks like the diagnosis is caries because I can see it right there in the procedure note. It also has been very helpful for if you are a treatment coordinator. I was a treatment coordinator in my practice for many, many years, following up on unscheduled treatment. And many times patients would, ask me on the phone when I'm talking to them, it's not hurting. Why do I need to have that crown? Why do I need to have that filling? Well, I could always see very quickly in the procedure note that there was caries there or there was a fractured tooth. So I've always really liked procedure notes. It's very quick access. It can show up on the treatment plan estimate if you're printing it out for the patient. Now, it's not the same as a clinical note, but it does attach itself to the procedure code. So then when you set it complete, that little diagnosis of caries will stay attached to that procedure code. And then, of course, your clinical note is separate. Your clinical note is always going to be that comprehensive documentation, and you would have the caries, the diagnosis also in your clinical note. But I do like that note box for a quick reference as to the condition of the tooth. Why are we treating this tooth? So that's my second option for you, is to use procedure notes.
Did you know that you could increase your team's productivity by up to 200% if you had a formal team training program in place? And businesses that do have a formal team training program in place also enjoy up to a 24% increase in profit margin. If you want to learn how and book a call with me, click on the show notes and book a free discovery call with me, and we will talk all about it.
A third option, which I think is going to be the future of dentistry, billing, and coding, because this is all going to revolve around a lot of coding. Because if we are going to be sharing records with physicians, sharing records with other entities, which is the goal here, is to be able to have our records more accessible and have the ability to see population or demographic data, we do want to use coding. And so another way that many of you have not started using yet, but I highly recommend, is that we add an ICD-10 code to it. So ICD-10 codes is the global standard for diagnosis codes. So you can attach multiple diagnosis codes to a single procedure code, and it can show up on your dental claims. It can also show up if you're using medical billing. So I think coding is a really great option for attaching the condition or the diagnosis to the procedure. So if you go into your patient chart and your treatment planning, then if you open up the procedure code, this is also where you'll find that procedure note that I just talked about. But right above that procedure note, you'll see diagnosis. If you click on the little arrows next to diagnosis, it will automatically pull up the most common cross-coded ICD-10 codes available for you to attach to this procedure code. So if you are diagnosing a filling, so right now I'm looking at my patient chart. I diagnosed a two-surface filling on tooth number 12. When I click on that select diagnosis code, it pulls up a lot of caries diagnosis options for me. So I could say, I'm just going to click on dental caries on smooth surface, limited, blah, 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 dental root caries, dental caries unspecified, cracked tooth. I also have fractured tooth, traumatic. So there's lots of diagnosis codes you could select here. No, you could select just dental root caries or dental caries unspecified. That would probably be very appropriate, unless you want to get a lot more familiar with all of these different types of dental caries. Now, in the ICD-10 world, there are over 65,000 ICD-10 codes. But what the Dentrix software has done for you already is cross-coded the most common ones that go along with fillings, crown preps, root canals, things like that. So I think using a diagnosis code with the ICD-10 coding is very appropriate and a very good option for you when you are looking at starting to document better and have a more future availability of your documentation. So I hope this helped. This was just continuing on our conversation of the 8 core oral health indicators that are slated for integration with the FDI and Henry Schein electronic health records project. So I hope this was helpful. And if you found this podcast helpful, and maybe you want to share it with your study club, or you want to share it with your friends, your colleagues, please do so. Share this episode with them. Also, you could do, we love 5-star reviews just as much as you do. So you can go to and give this podcast, if you're listening on Apple, give it a 5-star review. If you're listening to it on Spotify or on SoundCloud, we love reviews. So we appreciate it very much. All right, my friends, I hope you have a great rest of your day. And I look forward to watching your journey of becoming a high-performing dental team.